Go.
Imagine a girl who started smoking in the 5th grade. She continued well into her 20s when she became pregnant. She was unable to quit smoking during her pregnancy and had her baby 2 months early. Because of this, her baby had to spend weeks on an incubator and was severely underdeveloped. All that she had to say was, "I knew smoking was bad, but I didn't think I'd have a premature baby." This was Amanda's story, shared on the CDC website in 2016. This story illustrates the issue of prenatal smoking, which, although trivial to some of us, is still very prevalent, especially in New Mexico. As future health care providers and citizens of New Mexico, it is important to be informed on this issue and to make efforts to help decrease its prevalence. I still see people smoking while pregnant today, and it is an issue that I feel very passionately about, so I immerse myself in research so that I can adequately advocate for the cessation of smoking in mothers. Today, I want to tell you about how prenatal smoking has affected New Mexico, the negative effects of prenatal smoking, and what strategies should be adopted to decrease prenatal smoking. Our state doesn't have the highest rates of prenatal smoking. However, prenatal smoking is still relatively common in New Mexico. A large portion of the population in New Mexico smokes, and this trend continues even when a woman becomes pregnant. The results of a study conducted by the CDC and posted on the Morbidity and Mortality Weekly Report in 2009 showed that New Mexico was the 18th highest state in the United States for prenatal smoking. This rate was between 14.4% and 11.3% in the years 2001 and 2005. However, these were all reported from self-administered surveys. An article written in 2008 by Master of Public Health Alicia Allen and colleagues reported smoking rates in New Mexico from both self-reported surveys and birth certificates. This study revealed that approximately 11.3% of women admitted to prenatal smoking in the combined data. However, on birth certificates, this rate was only 6.8%. These results indicate that infants exposed to tobacco in utero may be 31% higher than is currently reported on birth certificates. The demographic of women who smoke, as reported in the Morbidity and Mortality Report, consisted predominantly of women below the age of 25 who had less than 12 years of education and were first-time mothers. This pregnancy was also more likely unintended, and the moms typically didn't receive care until later in the pregnancy after the first trimester. Since prenatal smokers are more likely to have these characteristics, they may not know the severity of the consequences that prenatal smoking can have. You may have heard before that prenatal smoking may cause a baby to have something like a hole in its heart. Although this is not necessarily accurate, prenatal smoking can cause numerous negative effects on the child's health. Prenatal smoking can increase the risk for premature deliveries, low birth weight, and sudden instant death syndrome, as reported by Dr. Dietz and colleagues in a 2010 article published in Clinical Key. Additionally, the CDC reported in 2016 that certain birth defects, such as a cleft palate, may be linked to smoking while pregnant. A more in-depth study conducted by researcher Hofwitz and others identified several other harmful effects, primarily on the child's respiratory system, as stated in the Archives of Disease in Childhood in 2003. This study revealed that smoking caused less oxygen to reach the fetus, thus decreasing lung growth and function and leading to a lower birth weight because there is not enough oxygen to support the growth of the organs. Prenatal smoking can also lead to an increased risk for acute lower respiratory illness, asthma, and wheezing, which makes it harder for the child to breathe and can cause challenges in the child's day-to-day life. Although these complications can sometimes arise even when a woman is healthy and does not smoke, all of the occurrences that involve prenatal smoking are completely preventable. Some government programs and support groups are already in place that are meant to decrease prenatal smoking, but these aren't always easily accessible to those who need them. The Pregnancy Risk Assessment Monitoring System is a system put in place by the CDC with the goal of decreasing prenatal smoking rates to 1%, a goal that has not yet been achieved in New Mexico. Some suggestions that could help achieve this goal have been outlined in the Morbidity and Mortality Report. The report proposed that tobacco ads should be restricted, especially those that target young people, since so many mothers that smoke are young. Also, smoke-free policies in public places and work environments should be encouraged, as well as an increase in the tax on cigarettes, therefore limiting the availability of smoking for mothers. Some changes in the health professions may also make a huge difference. Cessation counseling is offered, but only by about 30 to 60% of healthcare providers, so counseling opportunities should be expanded to all people who smoke. Medicaid and several other insurance companies offer coverage for tobacco dependence treatments, but most patients are unaware of this fact. These programs could be implemented in New Mexico, and insurance companies and hospitals should advertise for these and create more education materials that inform patients of the benefits of these programs. The results of a study from the Health Technology Assessment written by researcher Morgan and others in 2015 revealed incentives for women to quit smoking had positive outcomes. These included pay vouchers and funding for health services for mothers, and some of the others you see on the chart behind me. This, combined with support, feedback, and goal setting with the physician, showed even further improvements, and the prenatal smoking rate decreased to less than 10% in 2015. If we can increase the awareness of the repercussions of prenatal smoking by supporting government initiatives and future patients, perhaps the goal of decreasing prenatal smoking to 1% is reachable. Smoking has many detrimental effects on the fetus, all of which can be avoided with the cessation by the mother. Now that I've told you about New Mexico's incidence of prenatal smoking and how this can impact health, I hope that you better understand the need for strategies to decrease the rates of prenatal smoking. Decreasing these rates is one small step towards a healthier population, and Amanda's story may become less common.